Hello everyone. My group is going to present something very close and dear to our hearts. We are going to talk about choking and suffocation. Think of the home. This is supposed to be the child's safest place. But sometimes, unfortunately, accidents do happen within the home settings. Choking happens when a child swallows a piece of food or maybe a coin or some object and it gets stuck in their throat, making them unable to breathe. Suffocation takes place when a child's nose or mouth is covered and they are unable to breathe. Children may also suffocate if they are trapped inside a building or a place for too long that's not ventilated properly. Their bedding, such as their sheets or blanket, may also cause them to experience suffocation. Now, children may die as a result of choking and suffocation. Yes, recorded incidents show that several children have actually died from choking and suffocation. A 2-year-old was recorded in Jamaica suffering from an incident where she was choking, but fortunately her life was saved due to the quick response of the parents. When choking and suffocation incidents take place, parents blame themselves, especially if a child died. Now think about it. If your child was supposed to die and you were present, how would you feel? I bet, like many families, you would blame yourself, thinking, why wasn't I able to help my child? What could I have done better? Yes, parents actually live with the guilt and trauma after these incidents do happen. They are unable to move on with their lives even if children do not die. Some parents actually have to seek counseling since they may replay the incidents over and over in their heads. Now parents, this does not mean that you are a bad parent, but there are things that you can do to prevent choking and suffocation.
Choking often happens when a child eats food that are too big or too hard for them to chew. To prevent this, always cut food into small pieces. Avoid grapes, nuts, popcorn, and hard candy. Never leave a child to eat alone and make sure they sit while eating. In addition, toys can also be a choking hazard if they are too small. Choose age-appropriate toys. Avoid small objects like marbles, beads, or buttons, and always check toys for loose or broken pieces. Suffocation always happens when babies sleep with too many soft items or share a bed. To prevent this, place babies on their backs to sleep. Use a firm mattress with a fitted sheet and keep cribs free of pillows, toys, and loose blankets.
As we know, choking or suffocation is very common in infants and toddlers who like to explore by putting objects in their mouth or over their faces. Here are a few cultural practices that might increase that risk. We have leaving children unattended while eating. By doing this, children can put too much food in their mouth at once and this can cause choking. We also have giving them hard foods too early, for example, food like candy or peanuts. We also have overcrowded living spaces where small objects is very easily accessible. And then a very important one, we have believing that older siblings can safely supervise toddlers. These are some cultural practices that might increase the risk of choking or suffocation.
Good day, parents. In the case that your child is choking, the first thing you want to do is to check if your child can breathe or talk. Stay calm and quickly ask, can you breathe? Can you talk? If the child can talk, that means air is still moving. Therefore, you want to encourage the child to continue coughing. If the child is not breathing, talking, or the child is turning blue, then this is an emergency. You need to work on your child right away. First, you want to do the back blow. Standing or kneeling behind the child, you need to lean the child forward. Then using the heel of your hand, you're going to hit between the child's shoulder blade 5 times. If this doesn't remove whatever is blocking the child's airway, then we need to move to the abdominal thrusting. You're going to stand directly behind the child, lean the child slightly forward, and you're going to thrust inward and upward. And you're going to alternate 5 back blows, 5 abdominal thrusts. If this still doesn't work, then you need to contact your doctor or take your child to the nearest emergency. In the case that your child is suffocating, then you need to remove whatever is wrapped around your child's neck or covering your child's face, whether it's a sheet, a cord, whatever it is that is suffocating your child, you need to remove it as quickly as possible. If the child is not breathing, then you need to perform CPR and call an emergency. If the child is breathing and the child is acting fine, you still need to take your child to the doctor for a checkup, just to be sure. Parents, in the case that the child is choking, you want to first ask them, can you breathe? Then you want to stand. If they cannot breathe, you want to stand and slightly to them and you tilt them forward. And using your right hand, you use the heel of your hand and you give them 5 back blows. 1, 2, 3. You're increasing as you go, you're increasing. 4, 5. Can you breathe? They're still choking, then you go behind them, stand behind them, you tilt them forward, and you hold your hand in a fist. You use your thumb, you rest your thumb at their navel, then you use your other hand, you grasp that hand, you're going to thrust them about 5 times. 1, 2, 3, 4, 5. And then that should work. So there you see what was choking your child is now, their airway is now clear, they can breathe again.
Cultural factors can influence choking and suffocation by shaping what people eat, how they care for their child, and how they respond to an emergency. Diet and eating habits. Traditional food and eating practices can increase or decrease choking risk. Childcare practices. Cultural norms around infant sleep, feeding, and supervision affects suffocation risk. Health beliefs. Some cultures may underestimate risk or rely on traditional remedies, which sometimes cause harm. Education and awareness. Access to first aid training and safety information can vary to language, education, or trust in health systems. In short, culture influences both the likelihood of choking and suffocation and how communities prevent and respond to these emergencies. 2 effective strategies for reprogramming cultural mindsets to reduce choking and suffocation are 1. Culturally tailored education. Create awareness campaigns that respect cultural beliefs.
Conclusion: health, safety, and nutrition should not only be used for assignment purposes, because they are the heartbeat of family life. When parents make fruit time fun, when families fight lifestyle diseases with prevention, and when children are kept safe from risks like choking and suffocation, we are saving the lives of our future